All right, everybody, I'm going to introduce myself. That way we can spend our entire 30 minutes going through practice questions together. I'm so excited to hang out with you guys here over the next half an hour. So for those of you who haven't met me yet, my name is Rachel Taylor. I've been with Archer Review for almost 3 years. It'll be 3 years next month. And I absolutely love what I get to do. I love helping students find ways to be successful when they didn't know, the best way to go forward with them. So today, our big focus is going to be practice questions. And the reason why is because when you learn how to apply strategy and how to effectively answer practice questions, you are going to be not just a better test taker, but you're also going to be more confident in your answer choices, which is my big goal of the day. We've got Jennifer joining us in the chat. So if you have any questions, drop them in the chat and we will get to them when we can. Just a reminder, always be kind and courteous with your comments in the chat. We really do our best to answer each and every one, but if there's a question we don't get to, you can always email us, nclextutors@archerreview.com. So we're going to move kind of quick. Here's our first question. You're the nurse performing education for a client with AIDS at the community clinic. Which of the following statements is an example of appropriate teaching? All right, kind of rapid fire. Think through your answer. Drop it in the comments. Drop it in the comments. Welcome, welcome. Malika, glad to have you here. Glad you enjoy the lectures. Nice. I see lots of right answers on TikTok. Great job. Amazing. I'm seeing some right answers here on Zoom. Good. Indu jumped on just to let us know that they passed their NCLEX exam and they recommend Archer. Awesome. Thanks for letting us know. Kudos to you. Nice job. All right. I see lots of right answers coming through. So let's walk through this. First of all, we're thinking appropriate teaching. So I'm thinking which of these is true? A, do not wash your dishes with your roommate's dishes. Well, are we really concerned about washing the dishes? Well, thinking about it, washing dishes with someone else's or sharing, bathroom facilities, it's not going to protect the client or the roommate from the illness. So A is kind of irrelevant. I'm getting rid of it. B, clean all utensils and dishes before reusing them. Absolutely, we are thinking yes to B. Why? Because stagnant water and things that are food particles, what is that going to grow? Microorganisms. And when somebody has AIDS, what do we know about them? They are at high risk for infection, and I don't want them to get that infection. Now, C, do not use the same shower or toilet as your roommate. Well, when we think about, HIV, when we think about AIDS and we think about C, the bathroom facility isn't going to be what spreads the illness. So we're not going to really talk, C as a priority. Definitely thinking more B over C. And then lastly, D, hand sanitizer is not necessary unless you plan on touching someone else. Guys, hands are a major spread of infection. So we want to make sure that we keep our hands clean. Now, somebody's saying, hey, how do I get on Slido? If you've hung out with us, we like Slido. We are not going to be utilizing Slido today. We're just going to be doing it kind of the old-fashioned way, dropping your comments in the chat. All right, rapid 30. We're moving on to the next question. B was right on that one. The nurse is inserting a nasogastric tube, and the nurse is correct in performing which of the following sequential actions? All right, guys, this one's a little bit harder. So what we're going to do is we're going to do this one together. So I want you to tell me which thing would you put kind of in which order. So what I like to do, here's the strategy I utilize for questions like this, is I just take A, and I'm just going to kind of place it in the middle of my screen. Now, the reason why I do it this way is it makes it just a little bit easier for me to then kind of plug around it. So this would be a question I would use my whiteboard on. So we've got A. B, confirm placement. Where do you guys think B is going to go? Before or after A? Do you think it's going to be at the very beginning? Do you think it's going to be at the very end? Where do you think it's falling? Hey, Rosie, welcome. Glad to have you here. Or Rossi, I may be saying that wrong. All right, what do we think? I see lots of you saying, hey, that probably goes at the end. I agree, right? Like confirming placement, I'm thinking about that near the end. So I'm going to put that B toward the end. So I've used A, I've used B. Now C, insert the tube into the nasopharynx and advance the tube. Where do we think that's falling? Do we think it's kind of in the middle? Do we think that's going to be before A, before B? Where do you guys think that might fall? Nice. I see lots of you saying middle. I agree. Let's put it there. D, secure the tube to the client's nose and gown. Well, where do we think D is going to fall? After C, after B, after A? Nice. I see you guys saying that it belongs before B. I'm going to rewrite that, give myself a little bit more room here. Good. I agree. Now, E, instruct the client to swallow sips of water and advance the tube into the stomach. Where do we think that one's going to fall? E. Nice. I see lots of you saying after C or before D. You are right. And then lastly, F, measure the length of the tube from the nose to the earlobe to the xiphoid process. And that's going to go after A. You got it. So A, F, C, E, D, B. Now, what I do is I read that out loud and I make sure it makes sense. So I'm putting the client in high Fowler's. I then am going to measure the length, and I'm going to remember next. N for nose, E, earlobe, X for xiphoid process. And that's going to give me an estimate of the length I want to insert. So then I can go ahead and I can insert that tube. And as I'm inserting, I want them to swallow because that's going to advance the tube to the stomach. Then I need to secure it because otherwise if they pull it, it could just pull right out, right? And then lastly, we are going to confirm placement. Do we ever start suction before we confirm placement? What do we think? Nice job to those of you who got it right. We never start suction until we've confirmed placement. I have seen way too many of these be placed incorrectly. Now, one other quick tip here. Should we ever insert an NG tube on somebody with a basilar skull fracture? I normally don't like absolutes, but there are a couple of them. Thank you for those of you that are sharing the live. We appreciate it. Feel free to share the live or tag any other future nurses that you know so that they can get this free review as well. And no, we will never put it in for a basilar skull fracture. Why? Because it can end up in the brain, which is not where I want it. All right, everybody. Rapid 30. Let's move on. Question 3. Nurse is visiting a client who is 82 years old, has impaired vision, lives alone. It would be necessary for the nurse to follow up if the client states which of the following. All right, guys, I want you to try this one on your own. Drop your answers in the chats. Okay, I think the Zoom, people on Zoom might be the winner here. I see correct answers there. I'm seeing some correct answers come in on TikTok. Let's see, Facebook, YouTube, how are we doing? Not seeing them quite yet there. Nice job. Lots of right answers coming in. Let's talk through this. So if we have to follow up, does that mean we're looking for true answers or false answers? What do we think? When we see the word follow up, what does that indicate? True or false? What are we thinking here, guys? We're looking for things that are bad, like things that we're like, oh, my red flags, they're alarming, they're going off. So A, I secured my throw rugs to the floor with tape. Oh, goodness, guys, what's our big concern? These throw rugs are a fall risk. I cannot tell you the number of homes I've gone in, and our very wise population, our older population, they love throw rugs. It must be a generational thing because about everyone I know in that age range has a throw rug. And my mind automatically goes to, oh no, it's a fall hazard, right? Now, B, I switched to using an electric shaver instead of a razor. This is great. It decreases the risk of a cut. C, I usually sit in a recliner while I listen to the television. Hey, if they've got their feet up, we're getting blood flow back to the heart. That's great. We want to encourage that. D, I use, different shaped containers with lids to organize my meds. This is an awesome hack for med management. You can do different shaped containers for morning, afternoon, and evening. I've even seen some where they will automatically dispense. Really, really great trick there. And then E, I use the upstairs bathroom instead of the one downstairs. Ooh, I'm thinking about this. Do I want this individual going up and downstairs in the middle of the night when they have to go pee? Probably not, right? Again, major fall risk here. A and E are my concerns. Nice job on this one. Now, I just had someone join and they're like, hey, what's this live about? Answering questions. I want to really go through with you guys how to answer NCLEX style questions. Okay, here is our next one. For this one, I just want you to tell me your number one priority. I want to know your number one priority here. You're working in the ED. 23-year-old woman comes in after being bitten by multiple fire ants. You examine her. You notice there's many fluid-filled bites on her legs and her ankles. She's complaining of numbness in her face. You notice swelling around the lips. She complains of shortness of breath. Respiratory rate is 28. You hear wheezing when you auscultate her lungs. Heart rate is 110. Blood pressure is 82/40. So immediately, I want to teach you guys a strategy: airway, breathing, circulation. So my first thought goes to, is anything indicative of airway? There is swelling around the lips. I am concerned about swelling around the lips. Now, what things are telling me that there's a breathing concern? Shortness of breath. The respiratory rate is 28. I hear wheezing. And then lastly, what's telling me that there is circulation concern? What do you guys think? Heart rate is 110. The blood pressure is dropping. Because that blood pressure dropped, the heart says, I need to compensate. And if we need to compensate, it's going to increase the rate to try to compensate for that low pressure so that they can get oxygen to the necessary tissues. So what are you guys going to do first? What is your number one priority here? Nice. I see right answers. Great job. Nice. Absolutely. I agree. I agree here. Absolutely. B is my number one priority. I need to do B first. Now, what thing are you guys going to do second? Rico, congrats on passing your NCLEX, utilizing Archer to help in your prep stages. Congrats, congrats. Okay, what thing are we doing second, guys? Then I want to administer, right, that epinephrine. What am I doing third? So one, I'm checking the airway. Then I'm going to give epi. Then what? Then I want to see, hey, what's that heart doing? What's the heart rhythm? Do I have something that's concerning with that heart rhythm? And then lastly, I'm going to administer an antihistamine. It's not going to do a whole lot for me, but it might do a little bit of something. Nice job on that question, everybody. Now, real quick, I want to take a moment to talk to you about private tutoring. Private tutoring has been our hot topic lately. Students have been loving private tutoring, and what it is it's here to help guide and support you. If you are about to take finals in nursing school, if you are about to go take your NCLEX exam and you're like, I just need somebody to tell me I'm ready, to watch me answer questions like what we're doing today and assess, hey, do I have it or do I need a little bit of help here? If you're in that scenario, then go ahead, reach out. Yeah, Rosie said, I like Miss Elizabeth. Elizabeth is incredible. We've got Megan. Megan is the tutor that I'm going to highlight today. She is a peds expert. She has the most years of nursing education of anybody on our entire team. She is incredible. So if you want someone to go through your scores to help you with test prep, Megan is the person for you. Totally amazing. All right, back to our questions for Rapid 30. All right, select all that apply. Everyone's favorite. Let me know in the chat real quick. What do you guys think of SATA questions? Do we like them? Are we like, Rachel, I hate SATA questions. Please don't make me answer one. Where are we at with these? Okay, some are like, I like them. Working on getting better. 50-50, hate them. All right, I'm going to change your attitude about them, or I'm going to try. It probably won't be effective. Here's what I want you to think of SATA. I want you to think of SATA as an opportunity to showcase the knowledge you have. The reason why I emphasize this is when we change our mindset around these questions, when we change our mindset from I'm not capable to guess what, I can do this, you are going to improve. Mindset is so much when we think about the NCLEX, when we think about nursing school. It is so important. I cannot emphasize how important it is enough. So I want you to just say, hey, I've got this and I'm going to do the best I can. The best thing about NCLEX is you get partial points for these questions. Okay. You get partial points on these. For nursing school, it's kind of program specific what they do. But let's walk through it. Let's do it together. Let me go ahead and teach you guys the 3 steps to a select all that apply question. The nurse is discussing infection control with a group of nursing students. It would be correct to state that contact precautions with alcohol-based hand hygiene measures should be sufficient for which of the following conditions? Okay, guys, step number 1. Reword it short, sweet, and to the point. If you were to reword this in 5 words or less, what would you say? What is this question truly asking us? What do you think? What do we think? What's this question asking? It's asking, when can I use alcohol-based hand hygiene for contact, right? Like it's asking when that's enough. Or do we need to wash our hands? Like that we're looking for, is alcohol rub sufficient for these contact precautions? So A, RSV. What are we thinking? Are we saying, yep, it's okay for A? Or are we saying, oh, not sufficient? What do we think? Just give me a yes or a no. Okay, I'm seeing lots of yeses, and I will agree with you. Totally appropriate for RSV. Hand hygiene, it is contact precautions. We can just use hand sanitizer. What about B, mumps? What do we think about B? Well, mumps, are those contact? Remind me, are mumps contact precautions? Utilize that hint there. Mumps are not contact. Mumps is droplet precaution. So we know right off the bat, we can get rid of B. Now C, rubella. What about rubella? What type of precautions do we need for someone who is on rubella or who has rubella? What type of precautions? Again, with rubella, we need droplet precautions, okay? Now, do not get rubella confused with rubeola. I see it confused all the time. Rubeola is the measles. Rubella is German measles. Rubella or German measles are droplet precautions. Rubeola, which is just the measles, is airborne precautions. Don't get those two confused. I see them get confused all the time. Now, D, varicella. What type of precautions are needed for varicella? Nice. Nice. Airborne. That's when we're going to have that N95 or right, the full PAPR. We're like all gowned up. We've got it all when someone's got airborne precautions. So we do a lot of airborne precautions for people who have COVID, right? For people who have varicella, which is the chicken pox. Absolutely. Now, What about scabies? What do we think about scabies? What type of precautions do we need for scabies? Well, how is scabies spread? Scabies is spread through contact. So we can remember that this is contact precautions. Okay. So is alcohol-based hand sanitizer sufficient? Absolutely. All right. Now this last one, C. diff. Is C. diff contact precautions? What do we think? Okay, you guys are saying, hey, it's contact, but is alcohol-based hand sanitizer enough? Is that sufficient in this situation? Ooh, I'm seeing mixed answers. No, we have to use soap and water. So they almost try to like trick you here because like, yes, it's contact, but it's contact plus enteric precautions. We have to be utilizing soap and water because those alcohol hand rubs are not going to kill the C. diff spores. Anyone ever worked with someone with C. diff? Let me tell you, you don't want to spread it. It spreads like wildfire. I have, when I worked in the ICU, we would sometimes have several people from the nursing home come in and they would all end up with C. diff that they had gotten while they were in the nursing home. And so we just have to be really cautious. What I want you to always remember with, infection control practices is your stethoscope. One thing we don't always remember is our stethoscope is something that we use often. And that's why with certain precaution types, we utilize dedicated equipment because otherwise that stethoscope is a reservoir for infection, for germs. And so we want to make sure that's something we regularly clean as well. A and F are correct answers. A and F are the correct answers. Those are the only ones that are contact and alcohol, or sorry, A and E. A and E, I just said A and F. I had the right one circled there. A and E are correct answers there. Those are the only ones that I would say are contact plus, okay, contact plus alcohol-based is sufficient. Sorry, guys. A and E there. Had the right one circled, said the wrong letter. All right. What would the nurse expect to administer to a client who presents to the ED with a toxic acetaminophen level? Let me tell you guys, I have seen this kill somebody. I've seen somebody take too much acetaminophen and they ended up dying. This is super serious, and this is why we have to be very, very thoughtful about it. Nice. Lots of you are getting the right answer. Let's talk about it. So we would utilize what is called acetylcysteine. And what this does is it's going to basically take the toxic parts about acetaminophen and make it to where they are no longer toxic. Now, what I will say with this is it smells. It smells like rotten eggs. I have no better way to describe it other than it smells like rotten eggs. It's fine. That's expected. It's supposed to smell bad. Okay. Now, the other thing that I want to make sure you know is what these other medications are for. So if you see option B, that deferoxamine mesylate, does anyone know when we would use that? It's not a super common one, but I want us to talk about it. Anyone know when we would potentially utilize that one? Iron. When someone is iron toxic. Nice job. I'm super impressed you guys knew that one. Now see, Succimer. Anyone know when we would utilize Succimer? I know I'm really testing you guys, but it's really great to understand why the others are wrong. If you're struggling with your testing, that's the next step you want to take, is understand the why. So Succimer is going to be for lead poisoning. And then D, flumazenil. Anyone know when we would utilize D? What toxicity? Benzos, really important one to know. C and D, I see show up all the time. B is not as common, but C and D, I see all the time. So those are ones I would really write down, make sure you know those. All right. We've got another question coming your way. The nurse is caring for a client receiving chemotherapy for multiple myeloma. The client reports increased fatigue, difficulty completing their activities of daily living. Which of the following actions would the nurse perform? Ooh, this one's a little tricky. Take your time. Think through each option, one step at a time. Flumazenil is benzos. It's not lorazepam specific. It's the category of benzos. But I have seen it given for when someone has gotten too much lorazepam. Yes, great question. Nice. I see lots of right answers. All right, let's think about this. What were the key points in the question that I'm like, okay, this is the problem. Here's what I need to think more about. So, number one, they have increased fatigue. So, when somebody has increased fatigue, it's going to be harder for them to go do their ADLs. So, why do they have this increased fatigue? Well, let's think about it. They have multiple myeloma. They are at high risk for being anemic. And when somebody's anemic, they're not going to be able to transport enough oxygen to all the cells of their body. So, A, obtain laboratory orders to assess the client for hyperthyroidism. When someone has hyperthyroidism, they're very sped up. And because they're so sped up, they would have increase in energy levels, not fatigue. So we can say A is out. B, place a surgical mask on the client. What is that going to do? Like, that would protect them from getting germs. Absolutely. I don't want them to get sick, but that's not even addressing anything that's going on in the question. B is out. C, obtain an order for blood cultures. Well, blood cultures is what I would get when I'm concerned about sepsis. There's no indicator here that my client has sepsis. Sepsis, I would typically expect that their blood pressure is low, they're tachycardic, and the fever would come next. I don't see those indicators here. I'm saying C is out. So that only leaves me with D. Review the client's most recent hemoglobin and hematocrit. Well, why would I do this? Because I think they might be anemic, right? So this makes sense. Did you guys all notice how I went through these one at a time? I explained why they were wrong or why they were right. This is how you answer practice questions, whether you are a student in nursing school or you are prepping for your NCLEX. If you want to be a better test taker, this is the process you want to go through, because the more you understand the why, the more you're going to be able to make connections. And the more you make those connections, the better your clinical judgment is going to be. All right. Let's do one more question. Maybe two, but one more for sure. The nurse cares for a client with a complete third-degree heart block and hypotension. The nurse should take which appropriate action? What do we think? What do we think? Also, if you're like, hey, I enjoy this, I think it's fun, if you go ahead and you follow us on TikTok, if you're joining on TikTok, you should get like a notification, I believe, when we go live. I usually do about one of these every week. So if you want to give us a follow, you should be able to see when we do that. All right. Awesome. Amazing. I see some right answers coming through here. So let's go ahead. Let's think about this. Third-degree heart block. This is how I think of a third-degree heart block. I think of my grandparents. Unfortunately, my grandfather has passed away now, but when he was still alive, both my grandparents couldn't hear each other. So they'd be in the same room and they would be like kind of yelling at each other. Not that they were mad, just that they couldn't hear each other. And they were both kind of doing their own thing. They coexisted, but they couldn't actually like communicate together because they couldn't hear each other. And so what we think about is in a third-degree heart block, they're not communicating. It's like the P wave is over here doing this and the QRS is like going crazy. I can't even do it, right? But like, here's my P wave, here's my QRS. Like, they're just doing their own thing. They're not communicating with one another at all. Now, my P to P would be pretty regular. My R to R would be regular, but not in conjunction with one another. So it's like my ventricles and my atria are not connected. So what we have to do if somebody has a complete block is they need a pacer, and they're going to need a permanent pacer as soon as possible. So my first answer that I need is to figure out how to pace them. So A, temporary transcutaneous pacing. This is a great option while we wait for permanent pacer placement. So I'm going to keep A on the table. B, a prescription for esmolol, a beta blocker. Beta blockers drop the heart rate. When somebody has a third-degree heart block, their heart rate is low. They are going to be bradycardic. If I give them a beta blocker, I'm going to drop the heart rate even further. Totally contraindicated to give esmolol. C, begin chest compressions. Okay, hold on, guys. Do we start chest compressions on somebody with a pulse? No. This patient would probably come clock me one if I started compressions and broke all their ribs, right? So C is out. D, instruct the client to perform a Valsalva maneuver. Well, no, that's not going to be helpful in this scenario, which only leaves us with option A. Prepare that client for temporary transcutaneous pacing. Now, I'm curious, who here is in nursing school? Do I have anyone here who is still in nursing school? Nice job. A was the right answer there. Anyone here still in nursing school? I'm seeing lots of people saying, yes, I'm in nursing school. Okay, hang out. And even if you're not in nursing school, hang out. I'm going to show you each something really quick that I think is really awesome. So if you are in nursing school, I have got a great deal for you because you only have one more month to get it free. So if you are in nursing school, I want you to go to Archer Review, click nursing school. Maybe you guys already have this, but I want to show you if you don't. Kind of scroll all the way down and click buy now for free. Guys, right now our package that's normally $285 is totally free. And some of you are like, I'm in my last semester, I graduate. Get it. I would totally get it. If you don't have this yet, now is the time to get it because starting the 1st, it is going to be a paid product. So if you want one last chance to get this nursing school product for free, now is the time. Now, for those of you who are like, darn it, I just graduated and I'm in the NCLEX prep stage, don't worry, I still have something for you. So if you're in that NCLEX prep phase, what I want you to do is to go to NCLEX RN or PN. We have a deal going because of Thanksgiving. We do not normally run discounts, but we have got one going on right now. So again, like I see this once a year, if that we give a discount on our SurePass package. So what I would do is if you are looking for NCLEX review, I would get our SurePass package. Now, one of you was like, I've been out of nursing for 10 years. How many months should I do? Well, what I would do is I would go to courses, go ahead, click SurePass, and then you can see the different amounts of time that it's offered. For the individual who said, I've been out of school 10 years, I would get the 6-month package. Give yourself time. But if that's not your case, you could either choose between 60 days if you're going to go ahead and do the 6-week study calendar, or if you're going to do the 12-week study calendar, go ahead and get the 90-day package. So those are your different options. Why I love SurePass, by the way. I know I'm like a minute over here. Why I love SurePass and why I would get it if you are new to Archer Review is SurePass is going to include everything you need. It has all the tools in one spot for your NCLEX prep so that you can be successful on your exam. So what it has is it's going to have, number one, a 3-day live NCLEX review. We've got one this week, Wednesday, Thursday, Friday. So if you sign up today, you want to attend the NCLEX review this week, you can get in on it still. We usually have about 1,000 students a month attending it. Now, it also comes with our QBank, over 2,800 practice questions for the RN. It comes with over 100 hours of on-demand videos. It comes with our study calendars and Monday through Friday live lectures. Tuesdays and Thursdays are 3-hour live content lectures. Monday, Wednesday, Friday, 1-hour live case studies. SurePass is the way to go. I've seen thousands of students be successful on it. I'm excited to watch 1,000 more be successful on it. It's a really awesome product. I do not know when this special ends. Probably soon. I assumed it would have ended today, but it's still there. So I would use it now while it's still there because I expected it to be gone by the time I did this live. So now is the time. Now, one more person asked tutoring for the NCLEX. If you're interested in tutoring, go to private tutors. We have both nursing school and NCLEX tutors. Click which one you're interested in. Here's our NCLEX tutors. You can then click to see any openings. We have awesome small groups, guys. Small groups are super affordable. Small groups are $25 per hour. So here, Megan has test taking strategies. Elizabeth has basic care and comfort. On Wednesday, there's a 2-hour NCLEX review. This is my number one recommended small group to get into is the 2-hour NCLEX review. If you guys want a solid review before your exam, that's the one to go and get. And then there's also private tutoring available as well. If you're only interested in private tutoring, click here. If you're only interested in small group tutoring, click here. And then you can, filter through. If you add 3 or more sessions at the same time, you get 10% off. At 5 sessions, 15% off. And then at 10 sessions, you get 20% off. So lots of deals going on right now. Now's the time to go ahead and get what you were wanting for your NCLEX prep. All right, guys, that is all the time I have for today. Somebody did ask, can I get tutoring for farm only? Absolutely. Private tutoring is whatever you want to cover. So if you want farm, tutoring, book a private tutor session. If you want someone to go through OB, if you want somebody to go through peds, book a private session if there's not a small group available that fits the concept you want. All right, everyone. Thank you so much for joining. Let me know in the comments and in the chat, was this helpful? Do you guys like this style? We're currently planning our webinars for next year, and I'm curious if you guys think that this is beneficial. Our lives get saved on Facebook as well as on YouTube. Okay, I'm seeing yes, you guys thought this was helpful. Amazing, amazing. All right, guys, thanks for hanging out with me today. Good luck, whether you're a nursing school NCLEX or already graduated. Thanks for hanging out. Wish you the best of luck in all your future career. Bye, guys.